Nurses are the absolute backbone of the Irish Health Service, and I'm really pleased to be here today to lend my support to this initiative to continue to try and develop the highest possible standards in Irish nursing. And indeed, as we gather to reaffirm the values attached with Irish nursing, the values of compassion, of care and of commitment. Nurses on a daily basis not only provide care and comfort to our patients, but provide an invaluable role in the administration of treatment. And I'm really delighted to lend my support in my role as Minister for Health.
The health services have been met by a number of challenges over the recent years, and we've seen these challenges come to the fore in HICWA reports and in other health inquiry reports. When these challenges are presented, they are awful, but first of all, they're awful for patients. But they're extremely difficult for nurses and midwives to deal with as well. Nurses and midwives come into nursing to care, and they come into it because they love the job. This is not a job that you can do unless you absolutely love it. So what today is about is taking time out together as two professions to reconnect with our core values of care, commitment and compassion.
It means that we can reaffirm what nursing and midwifery is all about and why we became nurses and midwives in the first place. I also feel it's a really powerful motivator for people to revisit their commitment to their professions and to feel appreciated for what they do. I think that's really, really important. And I think it can only have a knock-on effect on patient care.
I believe there is a basic line, a bar that we should not go below. There's commonality with all nurses in respect of what we believe are our core values and functions.
I welcome the collaborative approach between the department, the NMBI and the HSE. We need these people working together, and the INMO will certainly become part of this process, because on behalf of nursing and midwifery, on behalf of nurses and midwives, we need to be reminded of this, we need to have this reaffirmed, and we also need the rest of the health system to know that they're our values and they should be their values as well.
Being with individuals and their families, taking a moment, pausing and being poised in caring with commitment and compassion.
Compassion for me is an emotional response founded on reason. So in healthcare, we operate through our heart space in collaboration with others with humility and understanding.
Compassion, I think, is captured very well by the concept GRAW, which is about being attentive and kind to a person, demonstrating warmth during a caring encounter, ensuring that they don't feel unduly embarrassed at any point, and that they're not a burden in any way.
Well, we were delighted that we had this initiative where the three organisations involved in nursing came together to identify, agree and commit to a set of values. And today is about reaffirming those values for every nurse and midwife in the country. We also have a plan on how we are going to embed these values in practice and we have a plan on how we're going to be able to sustain them in practice. So we look forward to this as being the beginning of a long journey.